Welcome to the Fort Myers Beach Good Neighbor Podcast Health and Wellness Series, brought to you by REnew Yu, Natural Health and Beauty, where we make wellness feel possible and turn everyday choices into stronger living. Each episode brings you uplifting conversations, local resources, and practical tips to help you look better, feel stronger, be emotionally balanced, and more connected to the community around you. So take a breath and settle in, because feeling better starts right where you are.
Welcome, good neighbors. Today is REYU 101. What is it? What does it feel like? What's it used for? And how to know if it's a fit? I'm here with Dr. Greet, and we're keeping this real simple and practical. So if you ever felt like you're treating symptoms but not getting to the root, this might be a new picture for you, something to look into. Dr. Greet, let's start with something basic. For those that aren't familiar with REYU for the first time, what is it?
Say the easiest way to explain it is healing from the inside. It's your body is doing what it's supposed to do, what it's made for.
Very nice. So if you had to describe it maybe in like one sentence, one simple way, how would you describe it?
Natural rejuvenation.
Okay. All right. Very good. So when you say REYU restores biofeedback loops, what does that practically mean for the body?
So when we use the REYU device, we put an electrode on your spine. So it really connects actually the treatment with your central system. So that is really, you have a pathway, an afferent way that goes to your brain, and then a way back that comes back the efferent way. So that loop is called the biofeedback loop. And that loop, the nervous system, is what we are regenerating or rejuvenating. Yeah.
So how do things like stress and aging or inflammation disrupt those loops?
Well, I think aging, especially inflammation, stress, chronic stress, stress in a short path can be good if you can control it then, but chronic stress is bad because it affects actually our everything on a cellular level. And with the REYU device, we actually work the opposite to make the cells, the ATP production of the mitochondrion, we make that better again.
Very nice. So that makes sense. So now listeners probably want to know, what does this look like if I come in for an appointment? Can you walk us through maybe a first visit? What happens?
A first treatment or before we started? The first treatment.
Yeah.
Mm-hmm. A first visit, I always explain to the patients, it's a natural rejuvenation technique. So what we really do is work with your central system and work actually with a current, a microcurrent that is charging your red blood cells. That means that the red blood cells can pick up more oxygen. And if the red blood cells are charged, they also have no friction anymore, so your blood flow is much better. Oxygen is really the most important thing for anti-aging. We cannot live without oxygen. That's why it's so important. If your body needs to heal from the inside out, we need to provide it with oxygen. So there is different, components. There is the healing the biofeedback loops, the nervous system, and then actually charging the red blood cells that can then take double at least of the oxygen level and go to the organs and here specifically to our skin. So better blood flow, more oxygen, more nutrition is anti-aging, is healthy skin or healthy texture, healthy underneath the skin, what is keeping our face up in place.
And then what do people usually notice right after, or do they notice anything immediately, or does it take a little while?
Well, it's we call it fillers or a quick fix. Here the REYU is actually, we call that more like a marathon. The fillers and Botox, we call it a sprint. So, but we have very good results immediately after one treatment. We will see that, of course, we have better blood flow, more oxygen, more nutrition. So we look very healthy and we actually drain the lymphedema system in your face so it doesn't look swollen. So overall, after the first treatment, if we take a picture before and immediately after, we look glowing and healthy.
Now, there's certain types of people that respond better than others.
In general, and we also, when we have a consultation, we talk about like healthy lifestyle. If you have a lot of damage from the past, like if you're a smoker, if you're a big drinker, you really can see that in your skin. Those clients take longer than people that already are active, eating healthy, and so on. They don't have as much damage, so they will see quicker results as we do the treatments.
Got it. So what are the main reasons people usually come to see you? Is it for their skin, face, their hair, maybe pelvic health?
Most of the time, in general, it's for the facial, for the skin of the neck and the face, and hair growth. Hair growth, it has very good results too, because it's the same principle. We stimulate the hair follicle by giving it more blood flow, oxygen, nutrition. And so that's again what it needs to have that hair follicle get strong and grow again.
So how do you decide what to focus on the first time somebody comes to see you?
Well, I listen what their problem is, what they see in the mirror and what they want to fix. Sometimes it's different than when I see, but I don't mention that. They want to fix what they see and feel better and transform to the way what they have in their mind.
And what are people say we're talking about skin and face? What's improvements do people see, first?
The first improvement they see, it's your skin gets tighter because, you really build up the muscles underneath, the structures underneath, your bone density. So the skin gets tighter, but also at the same time, because of the blood flow and the oxygen, your skin gets smoother and, it feels much and looks much better. That's why you get that glow immediately.
So how do you keep these improvements or results looking natural?
Well, we have we do a series. So as I said, it's not a sprint, it's a marathon. And for everybody, we like to do 4 in a row, week 1, week 2, week 4, week 6. And then we go over for maybe, depending now how the client responded, once a month for 4 more treatments. Long term, you can just do 3 a year. Some people like it so much because there is a relaxation with it that comes with it. People feel very relaxed. It's almost like a reset of your nervous system. So, but most of the time, we suggest just maintain, 3 times a year after you did the 8 treatments.
So let's talk about hair. We'll switch over to hair from the skin and face. Who's usually the best candidate? Somebody who's, early thinning or somebody who's had advanced loss?
No. So, we talk about thinning. Early thinning is, of course, the best. We need still a follicle to work with. If you're really bald, we cannot do anything. We need a follicle. So as long as we see a follicle, and we do that with a microscope. When you come in the first visit, we look at your scalp, see that there is the follicle still, even as tiny the hair might be, we see with the microscope still a follicle, then it's treatable. We also probably do make sure that your hormone levels, your thyroid levels, some other blood test, lab work, that your system, the base is good, instead of just jumping on it and there's maybe another cause. So we want to make sure that the underlying cause is treated, and then we start the treatment for the hair.
Got it. So I probably won't be the best candidate for that. I'm just saying, right?
It's actually, I have a real quick story. Dr. Caravani, who invited the device, and we had this question the other day. He's bald. So, and he, talks about hair growth and also on. So I had one client, he's like, why would I believe this guy that's bald about hair growth? So unfortunately, he was bald when he was 25 years old. So there is no follicle after he invented a device that he could stimulate. So, but it was a funny story. So bottom line is, we need still a follicle to work with.
Makes sense. So let's talk about the last one, urinary and pelvic health. How does REYU fit alongside of that in a pelvic floor rehab?
Well, we do actually. We work with the pudendal nerve in the pelvic floor area that is responsible for the activity of the bladder. And again, it works with the biofeedback loops. We make sure that the pudendal nerve and the communication with your central system is perfect. And most of the time, it's about only 4 treatments. That goes actually pretty well, pretty quick.
Very nice. So someone who's skeptical but open, how do you explain what you'd give them without over promising?
Well, I'm very realistic, and just if we talk about the face, I will say we never know. You might react different than this client, but we show before and after pictures from different ages, people that had very good results, people that had less results. There is always going to be a result, and there is no negative side effect. So if you give blood flow, oxygen, nutrition to any organ, to any tissue, it will get healthier. So I say you can maybe look 10 years younger, maybe 20 years younger. And if they had a good lifestyle, they can really see very quick changes, and they're very happy with it.
Now, there's other things out there, but are there certain things that you maybe avoid as far as claims are concerned, that overhype that other people may be using?
Oh, well, there is a lot on the market. If we talk about lasers, any laser, lasers in general, we talk about more treating the skin. We are treating the structure underneath. Our shape of our face is not made really by the skin. It's the structure underneath that keeps your face in shape. So when we use lasers, sometimes we really burn the underlying, the collagen, and it shrinks, and then it looks like tighter. But in the long run, it's like putting a steak on a very hot fire and burn it. I don't think you want to have that underneath your skin.
No,
it's like scar tissue. Yeah. So,
not at all. So are there certain people that should be cautious or get medical clearance before trying REYU?
Well, there is a few things that, that contraindications, like active cancer. We will never touch a client with active cancer. So actually, remember, cancer cannot survive in a high oxygenated state. It would be probably good, but we cannot claim that. If they have a pacemaker, and if they have epilepsy and pregnancy, those are the contraindications that we will not touch.
So you touched on a little bit with Southwest Florida. We deal with a lot of the sun, the heat, the dehydration, and outdoor living. How do these all combine to affect skin aging?
Well, dehydration, makes your skin dry. The sun damages your skin. When we treat people, with the REYU, we also educate them again, like, okay, if you're outside, use sun protection. We are returning the clock, but if you're still going to be outside without sun protection, then there is no point of doing anything. It's, you have to, it kind of change your lifestyle, and you have to, doing it, put your sun protection on all the time if you're outside, and reapply it. And there's a lot of education. A lot of people, sometimes they don't even know they want to put their sun protection underneath their moisturizer. It's like education is the key thing. Dehydration, that's very easy to treat with the REYU device. Pigmentation is very easy to use. We also, when we prep the skin for the REYU device, we also use active ingredients to take care of hyperpigmentation, hydration, and simple products with no preservatives. Like dextrose, for example, can be used for hydration. It's a simple product, and we infiltrate it as a prep with magnesium to do the microcurrent treatment. So it's all one package. So that's why your skin will look better. We educate the patient how to treat the skin when they're not in the office.
So if somebody wants to explore REYU, what's the first couple of steps they need to take?
Well, I think they have to come to the office, and we can do a consultation and see what their expectations are, in reality, what we can do and what they want. And I explain it in detail before we move forward. and then they make a decision. They have a choice. It's just like laying it out there. This is what we have available. We do only natural stuff here. Your body is supposed to heal from the inside. We don't put toxins here in our office, in our faces. We don't do fillers. We stepped away from it. Years ago, we did that when there was no data out that it was so unhealthy. But now when the data came out, more and more, I'm convinced that the natural rejuvenation is going to be the future. For sure.
Very, very nice. So any last words for our listeners today?
Stop putting the toxins in your face, please, because long-term you're going to regret, and then maybe there is no return. Try or discuss the natural rejuvenation and call our office, REnew Yu in Naples, 239-682-1306. I don't call that number myself a lot, so I always have to think about it. But call and get a consultation and see what your options are before you start putting toxins and paralyze your muscles with Botox. We do the opposite. We work your muscles back up and they can function normal.
I love it. I love it. Great advice. And once again, very educational. Thank you, Dr. Greet, for being such a good neighbor. And we'll see you out in the community soon.
Okay. Thank you, Jim.
Thank you for spending this time with the Fort Myers Beach Good Neighbor podcast, health and wellness series brought to you by REnew Yu, Natural Health and Beauty. If today's episode helped you, share it with a friend and check the show notes for local resources and next steps you can try this week. Until next time, be gentle with yourself, celebrate the small wins, and remember, better days are built one breath, one choice, and one good neighbor at a time. Also, to nominate your favorite health and wellness expert to be on the show, go to fmbgoodneighbor.com, that's fmbgoodneighbor.com, or call 239-427-4100. Until next time, remember to Cabo Antilia, Wabo, and keep being a good neighbor.